Well, hi, Dr. Mirander here with another Medical Minute. Today we just want to briefly talk about sunburns. It's amazing how easily this can occur, especially in persons of lighter complexion with red or blonde hair. Sunburns can happen in 30 to 60 minutes in these persons, especially in the hours of between 10 a.m. and 2 p.m. Sunburns are usually caused by the ultraviolet rays, usually the UVA and the UVB. The UVB rays are absorbed 90% within the epidermis, but the ultraviolet A rays penetrate much more deeper and are more significant as far as sunburns are concerned. Sunburns are usually first-degree burns, and it is best to try to prevent them than to treat them. Preventing them would mean perhaps wearing broad-brimmed hatwear, usually at least 3-inch rims, or umbrellas or more thickened clothing sometimes can prevent sunburns. When persons are wet or have lotions on, oftentimes the sunburns can be more significant. This is excluding, of course, creams to prevent sunburn. Usually, sunburns will cause quite a bit of redness and soreness of the skin. In more extreme cases, there might even be blisters. And for the most part, they are pretty innocuous, with just burning discomfort lasting for less than 24 hours. However, depending on the degree of burns that one might have, one can be looking at more distressing symptoms. One should imagine that, of course, there's a lot more loss of fluid through the sunburned skins. Sun exposure leads more readily to skin damage. There is more papuling of the skin, more skin lines, more dryness of the skin. Skin ages more readily. And of course, there's a propensity for skin cancers, such as basal cell cancers and squamous cell carcinoma. Of course, sun exposure is also toxic to the eyes, where one more develop cataracts and possibly even glaucoma. And so it is also wise to wear sunshades that are protected from the UVB rays. One should lend attention to hydration whenever sun exposure is overdone, and to cooling of the skin. Usually this can be done by cool soaks in water. I would recommend soaks 5 to 10 minutes, 6 to 8 times per day. Sometimes baking soda is added to the water, and people use all kind of topical things to try to alleviate the effects of burning on the skin. It is recommended that one should avoid products like lidocaine and products such as topical steroids, for they are not felt to be all that good to treat sunburns. However, there's calamine lotion that sometimes people use for its soothing effect on the skin. Some people use aloe gel topically and find good relief with that. Regular over-the-counter non-steroidals such as aspirins or Tylenol or ibuprofen are sometimes used to take care of some of the painful discomfort. But sometimes even narcotic medications is indicated just because of the significance of the distress that one should have. If somebody is getting dizzy or nauseous or maybe not passing urine, then this is a serious state condition, and one needs to see a physician about that. For one might even be so badly burned that they might have to be admitted to a burn unit. Well, just to bear in mind, prevention is better than cure. Try to avoid those extreme areas of the day, the 10 a.m. to 2 p.m. region, and do lend attention to clothing and sunglasses wear to protect the skin. Once again, Dr. Mirander here in a Medical Minute. It was a pleasure.